The autumn wind howled through the towering glass windows of Riverdale Medical Center, carrying with it the whispers of change. For years, the hospital had operated under a rigid, profit-driven regime where efficiency was valued above humanity. Doctors and nurses had been forced to suppress their instincts, to treat patients as numbers rather than people. But tonight, that was all about to change. Dr. Rebecca Lawson sat in a dimly lit conference room, her hands trembling as she leafed through the stack of damning documents spread before her. The evidence was undeniable. Project Compassion, an initiative designed to bring humanity back into medicine, had been systematically dismantled by the administration. Acts of kindness had been labeled as inefficiencies, and caregivers who prioritized empathy had been reprimanded or dismissed. Rebecca herself had been one of its casualties, fired for the simple act of comforting a terminally ill patient's pet, an act of care deemed unnecessary and disruptive. Across from her sat Charlotte Green, a tenacious legal advocate who had spent the last 6 months building a case against the hospital's administration. Beside her was Olivia Reed, an investigative journalist whose exposé on the lost healers had ignited a storm of public outrage. And at the head of the table, resolute and unwavering, was Dr. Samuel Ortiz, once a loyal member of the administration, now a defector determined to correct his past mistakes. "We have everything we need," Ortiz said, his voice heavy with regret. "Financial records, internal memos, security footage, it's all here. But if we don't act now, they'll bury it. We have one shot at this." The door burst open, and Officer Maria Martinez stepped in, her face etched with urgency. "We've confirmed unauthorized access to the archives again tonight. Someone is still trying to destroy the files. If we don't move fast, the truth could disappear forever." The decision was made. They would present their findings before the hospital board that very night. Outside, a crowd of hospital employees, patients, and community members had gathered in the atrium, their voices a chorus of demand. "We deserve transparency. We demand accountability." Inside the boardroom, the atmosphere was suffocating. The reform faction, emboldened by the irrefutable evidence, stood firm against the old guard, who clung desperately to their crumbling authority. Louise Carmichael, the hospital's chief administrator, had once been the iron-willed enforcer of the rigid policies, but tonight her usually unshakable confidence wavered. "This is not just about policies," Rebecca said, her voice steady. "This is about people. Every number on your financial reports represents a human life, mother, a father, a child, and we have failed them." The room fell silent. Then, one by one, the reform-minded board members cast their votes. The decision was final. An immediate external audit of hospital practices, the public release of Project Compassion documents, and a commitment to a new era of transparency and empathy. As the verdict was announced, a murmur of disbelief spread through the crowd gathered outside. Then, a thunderous cheer erupted. Tears streamed down faces. Strangers embraced. The weight of years of suppression lifted, replaced by a fragile yet undeniable hope. In the days that followed, Riverdale Medical Center underwent a metamorphosis. The newly formed Oversight Committee worked tirelessly to rebuild trust. Doctors and nurses who had once walked on eggshells now felt empowered to care with their hearts, not just their hands. Compassion circles formed safe spaces where staff could share their struggles and triumphs, fostering a new culture of support. Olivia Reed's exposé had not only exposed Riverdale's dark past, but had sparked a nationwide conversation. Hospitals across the country began reevaluating their practices, inspired by Riverdale's courageous stand. Patients, once resigned to being faceless entries on a chart, found themselves heard and valued. One evening, Rebecca stood outside the hospital, watching the sunset paint the sky in hues of gold and crimson. At her feet, Hope the stray puppy who had once symbolized the very act of compassion that led to her dismissals snuggled against her. She reached down, running her fingers through the pup's fur, a soft smile on her lips. "We did it, Hope," she murmured. "We really did it." As the hospital's lights flickered on, illuminating the corridors that had once been shrouded in secrecy, She knew that this was only the beginning. The battle for compassion was far from over, but for the first time in a long time, there was light at the end of the tunnel. And this time, no act of kindness would ever be hidden in the shadows again. The battle for compassion had been won, but the war for institutional change had just begun. Louise Carmichael had been removed from her post, but not without a fight. In an exclusive interview, she lashed out at her critics, insisting that efficiency will always trump sentimentality in the business of healthcare. Rebecca and her allies knew that such mindsets wouldn't disappear overnight. They worked day and night to ensure the reforms weren't just symbolic gestures, but real, lasting changes. A national symposium on ethical healthcare was held at Riverdale Medical Center, attracting doctors, policymakers, and advocates from around the country. The movement had begun. Dr. Samuel Ortiz, once a shadow of regret, had found redemption in his newfound purpose. He traveled from city to city, sharing Riverdale's story, urging others to take up the fight. Olivia Reed's expose evolved into a full-fledged documentary, reaching audiences worldwide. And Rebecca? She stayed at Riverdale, reclaiming the job she had once lost. But this time, she wasn't just a doctor. She was a leader, a mentor, a beacon of hope for those who believed medicine could be more than just science. It could be humanity itself. Years later, Riverdale Medical Center would stand as a model of ethical healthcare, a testament to what could happen when people chose to fight for what was right. The name Project Compassion was no longer just a memory of what was lost, it was a promise of what was possible. And under the soft glow of the hospital's entrance, where countless lives had been saved and countless battles had been fought, a plaque now stood, etched with a single phrase: "In the service of humanity, no act of compassion is ever too small."